A coronary angiogram is a procedure that uses X-ray imaging to see your heart's blood vessels. The test is generally done to see if there's a restriction in blood flow going to the heart. Cardiac catheterization procedures can both diagnose and treat heart and blood vessel conditions. Coronary angiogram, which can help diagnose heart conditions, is the most common type of cardiac catheterization procedure. Your doctor may recommend that you have a coronary angiogram if you have symptoms of coronary artery disease, such as chest pain, angina, pain in your chest, jaw, neck, or arm that can't be explained by other tests, new or increasing chest pain, unstable angina, a heart defect you were born with, congenital heart disease, abnormal results on a non-invasive heart stress test, other blood vessel problems, or a chest injury, a heart valve problem that requires surgery. Because there's a small risk of complications, angiograms aren't usually done until after non-invasive heart tests have been performed, such as an electrocardiogram, an echocardiogram, or a stress test. Acute coronary syndrome, angina, coronary artery disease, heart attack, heart disease, mitral valve, prolapse, myocardial ischemia, small vessel disease, sudden cardiac arrest, Takayasu's arteritis, ventricular tachycardia. As with most procedures done on your heart and blood vessels, a coronary angiogram has some risks, such as radiation exposure from the X-rays used. Major complications are rare, though. Potential risks and complications include heart attack, stroke, injury to the catheterized artery, irregular heart rhythms, arrhythmias, allergic reactions to the dye or medications used during the procedure, kidney damage, excessive bleeding, infection. In some cases, coronary angiograms are performed on an emergency basis. More commonly, though, they're scheduled in advance, giving you time to prepare. Angiograms are performed in the catheterization cath lab of a hospital. Your healthcare team will give you specific instructions and talk to you about any medications you take. General guidelines include: don't eat or drink anything after midnight before your angiogram. Take all your medications to the hospital with you in their original bottles. Ask your doctor about whether to take your usual morning medications. If you have diabetes, ask your doctor if you should take insulin or other oral medications before your angiogram. Before your angiogram procedure starts, your healthcare team will review your medical history, including allergies and medications you take. The team may perform a physical exam and check your vital signs, blood pressure, and pulse. You'll also empty your bladder and change into a hospital gown. You may have to remove contact lenses, eyeglasses, jewelry, and hairpins. X-ray cameras will move over and around your head and chest to take pictures from many angles. You may be given a sedative through the 4 to help you relax, as well as other medications and fluids. Your chest monitor your heart throughout the procedure. The dye is easy to see on X-ray images. When the angiogram is over, the catheter is removed from your arm or groin and the incision is closed with manual pressure, a clamp, or a small plug. You'll need to lie flat for several hours to avoid bleeding if the catheter was inserted in the groin. During this time, pressure may be applied to the incision to prevent bleeding and promote healing. Your puncture site is likely to remain tender for a while. You notice bleeding, new bruising, or swelling at the catheter site. You develop increasing pain or discomfort at the catheter site. You have signs of infection, such as redness, drainage, or a fever. There's a change in temperature or color of the leg or arm that was used for the procedure. Weakness or numbness in the leg or arm where the catheter was inserted. You develop chest pain or shortness of breath. If the catheter site is actively bleeding and doesn't stop after you've applied pressure to the site, contact 911 or emergency medical services. If the catheter site suddenly begins to swell, contact 911 or emergency medical services. An angiogram can show doctors what's wrong with your blood vessels. It can show how many of your coronary arteries are blocked or narrowed by fatty plaques, atherosclerosis. Check the results of previous coronary bypass surgery. Check the blood flow through your heart and blood vessels.
Thank you for watching this video. Hit the subscribe button so you can get new videos. You can read more about this on our website www.wellnessbuddy.com.